That's why we're very cautious then to do adjustments where we do rotation and do a pull, because you're actually pulling that spinous process back into the rotation of the curve. Okay? We could explain that more, but I just want you to think about that for those of you who are going into biomechanics and those of you who are doing movements and movement disorders. But more importantly, those of you who are looking for a physician to take care of you, look for somebody who's actually trained in biomechanics in such a way that they understand aberrant movements of the neck before they just adjust or make a correction. Okay? Question?
Yeah, I have ankylosing spondylitis, which they said deteriorates all those little pads that you were talking about.
Mm-hmm.
It kills me to turn my head or go up or down. Mm-hmm. Should I do exercises though to do that, or go to a chiropractor to keep those moving? Because
great question. So the question right now is ankylosing spondylitis, and if you don't mind, we'll set this as a topic to get to in just a moment. Okay?
That's fine.
So I'm just going to put it here as AS, ankylosing spondylitis. Okay? That's a great question, though. And it's an important question that we answer, and we'll answer that before we go tonight. Okay? When we look then at this degree of movement in this area of the cervical spine or in the spine, we want to see that those ranges of motion are full. What creates an aberrancy in the movement? Some type of degenerative change. Okay? So we can call that arthritis. What can create a change in the movement or aberrancy of motion? A bulging or protruding disc. What else can cause that loss of movement or function? A desiccated disc, or something we call degenerative joint disease, or even degenerative disc disease, DDD. Okay, which basically these two are the same and these two are the same. Okay? What else can cause changes, though, in ranges of motion in the neck? Have any of you ever seen something called torticollis or wry neck? What's torticollis, Jim?
When the SCM is pulling to one side.
Yeah. So this muscle, the sternocleidomastoid muscle, will actually start to pull. It'll pull a person's head into this posture. I've seen several patients where their head and their neck are actually in this posture, and this is how they function. Okay? So muscles can actually create aberrant motion. What else can create a loss of range of motion?
Injury.
Injury. Okay? So injuries. Okay? What else can change range of motion? How many of you have ever had an infection where you've had your lymph nodes swollen and now your head doesn't move, or you've had a fever and you have that really tightness in your glands? Anybody had that or known of somebody that's had that? So infection can create loss of range of motion. And the interesting thing is, we don't limit that infection just in the neck, right? Head and oral pathologies, including sinus infections and tooth infections, often can cause aberrant motions in the range of motion in the neck. Okay? How many of you have ever seen a person with an enlarged thyroid? It makes it difficult for them to swallow. They've actually had thyroids that are large enough that it impairs their movement. Has anybody ever seen that? Okay, those are large goiters, but I've seen that before. Okay? So we actually look at then inflammation associated with some type of an autoimmune disease. Okay? So autoimmunity, like ankylosing spondylitis, rheumatoid arthritis, lupus, Sjogren's disease, and several others that fall into those categories can create aberrant ranges of motion. Okay? Anything else that you can think of that would cause loss of range of motion in the head or in the neck? Temporomandibular joint can also create loss of range of motion. Remember, the joint mechanoreceptors of the jaw have as many proprioceptors when we summate them as do all the joint mechanoreceptors in the body. Let me say that a different way. If we were to look at the joint receptors in my knees, my ankles, my toes, my hips, my spine, my arms and extremities, okay, all of those joints summated are the same neurologic pools dedicated as there are, and actually greater numbers, in just our jaw joint alone. Okay? How important is an optimally functioning jaw joint? It's absolutely essential to our health and our body's ability to maintain its upright posture and position. Okay? It's even more fascinating when we look at the temporomandibular joint because of its ability to exert as much as 2,000 pounds of pressure when we occlude. Okay? When we exert down or bite with this masseter muscle, a full ton of pressure. You see people pulling on Ripley's Believe It or Not, or whatever those guys that hold a bite and pull a train or pull a truck. And yet, bless you, that same jaw that could exert 2,000 pounds of pressure can detect a piece of hair in my Jell-O salad. Right? Isn't that fascinating? Can actually bite through the coating of an M&M and stop before we crush our teeth together when it goes through the soft part. Isn't that amazing? I think it's fascinating, really. Could you imagine, though, if our feet were that sensitive and you stand in the bathroom getting your hair ready in the morning, you feel like a cat? If you could sense hair on your feet like that. Wouldn't that be an awful experience? Ugh. Okay, anyway, that's how sensitive that jaw can be. The jaw, when there's an aberrancy, can actually create then head tilts or ocular tilts that create then aberrant movements in the entire spine. Okay? Our eyes always want to be on what we call a righted reflex. If our pelvis is off, if our knees are off, if I'm on crutches, okay, we can create aberrant movements in the entire kinematic chain, which may then create aberrant movement in my neck. Okay? So scoliosis, people with severe scoliosis, people who've had strokes, okay, may actually have aberrant movement that creates then aberrancies for their brain. People who've had other cerebral palsies or brain damage can end up with different head postures that can create loss of range of motion in the neck. Okay? And of course, again, as we started, those people who have overuse injuries, okay, never dentists again, right? And never computer programmers, and never people who are working as a teller or someone who's always looking at the computer screen off here while my computer keyboard sets here. Never people who hold their phone like this have any problem with their neck, right? This never would create a problem. How many of you used to be secretaries before there was really a cordless phone? Remember that?
Old phones were better.
Yeah, they actually had that big earpiece and a cradle, huh? We actually had the mouthpiece that actually not fed around to the mouth and something back here at the ear. I think it would have been great when the old box on the wall, you know, nobody could have ever cradled that, had the old box on the wall. Now that probably was the most biomechanically efficient phone that ever existed. Okay? Let's talk about then these different things and how they present. First of all, let's talk about how a disc presents, because everybody knows about disc problems in the low back, but what is a primary symptom associated with disc injuries in the neck? Let's look at this for just a moment. So if we're looking at a person from their back, okay, here's their neck. One of the most common referral pain patterns of a disc injury in the neck is a hot water or burning sensation on the inside of the shoulder blade. Okay? One of the most common symptoms and signs that we see of disc problems in the neck is a sense of hot water or a burning pain or a searing pain along the inside border of the shoulder blade. These are the people that come in and say, can you just massage this for me? And we work on it, and they stand up and they say, that felt good. And then they go and get in their car and their arm and their shoulder feels heavy again, and they have hot water burning sensation down their shoulder. Why is this? In your first aid courses, a left arm pain with left jaw pain is indicative of what?
Heart attack.
A heart attack, okay? But the heart is out here in the front. So how does that heart get into the arm and into the neck? Why do I have left arm pain, okay, and left jaw pain if I have a problem with my heart? This goes all the way back to before baby was born, embryologically, when baby was forming inside of mom. First these two little cells meet, okay? Then they start to divide rapidly. Then they form a little flat plate. Then this flat plate becomes in essence a tube. This tube starts to elongate until one side becomes differentiated into a head and the other differentiates into a tail. And then limb buds pop off of that and we end up having baby. Okay? This disc though is starting to elongate within the first few days of existence, and initially the cells that are up here that will eventually become the head, we actually have what are called gill plates in the neck. Okay? Those gills actually start to elongate and differentiate such that our diaphragm that we breathe with originally started clear up in our neck at the level of C1, 2, 3. C3 is where our diaphragm actually started and then migrated down as we filled these gill plates with organs. 3 chambers of lung on our right side, okay, and 2 lung chambers on our left side, with the heart being the 3rd chamber. Isn't that fascinating? I think it's amazing. Okay? And as that's growing then and elongating then, the heart, this arm bud and this neck and jaw actually were originally right here together, and then they elongated out. Okay? I think it's fascinating. So the neck actually, and the disc areas in the nerve, when we look at those nerves, originally started all at one disc level and then started migrate as baby was forming, until now we get what we call a referral pain pattern associated with discogenic pain. Okay? Kind of neat.